1. U.S. bird flu emergency ends as infections decline. 2. CDC merges bird flu updates with seasonal influenza. 3. CDC ends bird flu emergency response as U.S. infections drop. 4. CDC ends emergency response to H5N1 bird flu, what you need to know. 1. U.S. bird flu emergency ends as infections decline. In a world where health crises can escalate rapidly, the recent developments in the U.S. regarding bird flu might come as a relief to some. But here's where it gets controversial. While the emergency response has officially ended, questions linger about whether we're truly out of the woods. The U.S. Centers for Disease Control and Prevention, CDC, announced that they had wrapped up their emergency measures aimed at controlling the bird flu outbreak. This decision comes after months of intense efforts to manage an alarming spread of the virus, which not only affected humans but also infiltrated cattle populations and caused a spike in egg prices across the nation. To provide some context, the bird flu outbreak created widespread concern among public health officials, farmers, and consumers alike. At its peak, the virus infected dozens of people, leading to heightened surveillance and precautionary measures. It disrupted supply chains and caused economic ripples that were felt far beyond the agricultural sector. For instance, the rise in egg prices became a hot topic in households, with many families struggling to adjust their budgets amidst the inflationary pressure. And this is the part most people miss. The interconnectedness of health crises and everyday life often goes unnoticed until it hits close to home. According to sources familiar with the situation, who chose to remain anonymous due to confidentiality restrictions, the CDC officially lifted the emergency designation during the last week. This move indicates that infection rates have significantly declined, signaling a step toward normalcy. However, the decision wasn't made lightly. Public health experts meticulously analyzed data trends, transmission rates, and containment efforts before concluding that the threat had diminished enough to warrant scaling back emergency protocols. But what does this mean for the future? While it's tempting to breathe a sigh of relief, history reminds us that viruses can be unpredictable. Some critics argue that ending the emergency response prematurely could leave the country vulnerable to another wave of infections. Others believe that transitioning to a more sustainable, long-term strategy is essential to balance public safety with economic stability. So, where do you stand on this issue? Do you think the CDC acted too soon, or was it time to shift gears? One thing is certain, vigilance remains key. Even though the immediate crisis appears to have subsided, ongoing monitoring and research are critical to prevent future outbreaks. Farmers, veterinarians, and healthcare providers must continue working together to ensure early detection and swift action if the virus resurfaces. Moreover, investments in vaccine development and biosecurity measures will play a pivotal role in safeguarding both human and animal populations moving forward. As we reflect on this chapter of the bird flu saga, one question looms large: how prepared are we for the next potential health emergency? The debate over how to strike the right balance between proactive intervention and resource allocation continues to spark differing opinions. So, let's hear from you. What lessons should we take away from this experience, and how can society better prepare for unforeseen challenges in the future? 2. CDC merges bird flu updates with seasonal influenza. Imagine a world where tracking bird flu becomes just another part of the regular flu monitoring process. That's exactly what the U.S. Centers for Disease Control and Prevention, CDC, has done by merging H5N1 bird flu updates with their routine influenza reports. But here's where it gets controversial. Some experts argue that this change might downplay the severity of bird flu, even though the virus has shown aggressive behavior in spreading among livestock. Starting this month, the CDC will report the number of people being monitored and tested for bird flu on a monthly basis, rather than providing daily updates. Additionally, they've decided to stop reporting infection rates in animals on their website. This decision comes after the virus infected 70 people, primarily farm workers, and claimed one life in the past year as it moved swiftly through cattle herds and poultry flocks. Experts remain vigilant, warning that the continued spread of bird flu poses a significant risk of increasing its ability to infect humans. Despite these concerns, the CDC maintains that the current public health risk from bird flu remains low. Earlier in the day, Bloomberg News reported that the CDC has ended its emergency response for bird flu due to the outbreak's decline. However, this doesn't mean the threat has disappeared entirely. The U.S. Department of Health and Human Services, which oversees the CDC, didn't comment on the Bloomberg report when Reuters reached out for an official statement. This lack of response adds another layer of intrigue to the situation. This year has been particularly challenging for the country's response to bird flu. Staff shortages at the U.S. Department of Agriculture, a result of the Trump administration's efforts to reduce the federal workforce, have caused disruptions. Furthermore, the government canceled a $700 million contract awarded to Moderna for the advanced development of a bird flu vaccine for humans. These events highlight the ongoing complexities and challenges in managing and preparing for potential pandemics. So, what do you think? Should bird flu continue to be treated as a separate concern, or is it reasonable to merge it with regular flu updates? Let us know your thoughts in the comments. 3. CDC ends bird flu emergency response as U.S. infections drop. Imagine a world where a deadly bird flu pandemic spreads rapidly, infecting millions of people and causing widespread chaos. This is not just a fictional scenario, but a very real threat that has been looming over us for years. Fortunately, the U.S. Centers for Disease Control and Prevention, CDC, has just announced that it is ending its emergency response to the H5N1 bird flu, citing a significant decline in animal infections and no reported human cases since February. But here's where it gets interesting. The virus has already infected 70 people and killed one person over the past year, mostly farm workers who came into contact with infected cattle herds and poultry flocks. The CDC's decision to deactivate its emergency response on July 2 may seem like a positive development, but experts warn that further spread of the bird flu could raise the risk of it becoming more transmissible to humans. So, what does this mean for public health? The current risk from H5N1 bird flu remains low, according to the CDC, but the agency will continue to monitor the situation and scale up activities as needed. This is the part most people miss. The CDC will no longer report infection rates in animals on its website, but will instead provide monthly updates on the number of people monitored and tested for bird flu. The country's response to bird flu has faced several disruptions this year, including a staff exodus at the U.S. Department of Agriculture and the government canceling a $700 million contract with Moderna for the development of a bird flu vaccine for humans. This raises an important question. Are we doing enough to prepare for a potential bird flu pandemic? The CDC's emergency activation allowed for additional support for public health responses, including staffing and resources to increase testing, surveillance, and communications during an outbreak. But some might argue that the CDC's decision to end its emergency response is premature, given the ongoing risks associated with the virus. The CDC H5N1 bird flu response was activated on April 4, 2024, and since then, the agency has been working tirelessly to monitor and respond to the outbreak. Now, it's up to us to stay informed and vigilant, and to demand that our leaders take the necessary steps to protect us from this potentially deadly threat. So, we ask you, do you think the CDC's decision to end its emergency response is justified, or do you think we should be doing more to prepare for a potential bird flu pandemic? Share your thoughts in the comments below. 4. CDC ends emergency response to H5N1 bird flu, what you need to know. The Centers for Disease Control and Prevention, CDC, has officially concluded its emergency response to H5N1 bird flu, signaling a pivotal shift in public health strategy as the virus's threat diminishes. This decision came after a dramatic decline in reported animal infections and the absence of human cases since February 2025, marking a critical turning point in the battle against avian influenza. As of July 2, 2025, the CDC's emergency protocols for H5N1 bird flu were deactivated, transitioning the agency back to its regular influenza monitoring programs. A spokesperson for the U.S. Department of Health and Human Services confirmed this move, emphasizing that surveillance, readiness, and response mechanisms will remain intact under the CDC's Influenza Division and other relevant agencies. Dr. Nirav Shah, who resigned as CDC Principal Deputy Director this year, expressed his support for ending the emergency response, stating it was not a top-down directive but a grassroots decision driven by career scientists. The rationale is simple: there have been no human cases, so there's no need for constant, all-out responses, he explained. If more cases emerged, we could quickly adjust the intensity of our efforts. It's a matter of scale and urgency. Shah, now a visiting professor at Colby College, highlighted the virus's evolution from a global threat to a manageable concern, noting that its impact has shifted from widespread outbreaks to localized risks. The H5N1 emergency was declared on April 4, 2024, and allowed the CDC to allocate additional resources to public health initiatives, including staffing and rapid response teams. However, the virus's reach extends beyond poultry, with reports of infections in over 1,000 herds across 17 states and dozens of mammalian species in more than 100 countries. In early 2024, the virus infected U.S. dairy cattle, raising concerns about the dairy industry's vulnerability. Despite these challenges, the CDC has tracked a slowing decline in reported cases, though experts caution that bird flu exhibits seasonal patterns, with peaks in fall or early winter. Some federal agencies may have missed mild cases due to shifting priorities, but serious outbreaks remain unlikely. As of now, the public health risk from H5N1 is considered low, but the CDC remains vigilant. The current situation is stable, but we will continue to monitor the virus and adapt our strategies as needed, the HHS spokesperson stated. This decision reflects a broader trend of reducing emergency measures as the virus's threat recedes, yet underscores the importance of preparedness for future outbreaks. But here's where it gets controversial. While the CDC's decision to end the emergency response is widely viewed as a relief, some experts argue that the virus's potential to mutate and re-emerge necessitates ongoing vigilance. The virus's history as a global pandemic threat, coupled with its ability to infect diverse species, means that even a temporary pause in emergency measures could leave gaps in preparedness. As the public health community weighs the balance between resource allocation and readiness, the debate over whether to maintain emergency protocols or fully transition to routine monitoring continues to evolve.